Hi, my name is Laura Rojas-Rozo and I'm a research assistant from Team 19. Today I am going to present the results from our project called Improving Quality of Dementia Care, Insights from Audit and Feedback in 8 Primary Health Practices in Ontario. Many primary care practices in Ontario have implemented models for detecting, diagnosing, and managing dementia in their practices. This study aims to describe the opinions of primary care physicians, managers, and staff after being presented with performance information on dementia care. We carried out an audit and feedback activity. For the audit component, data was obtained from 3 sources. First, we carried out a retrospective chart review obtaining information from indicators of the quality of follow-up for dementia. Then, we measured the knowledge, attitude, and practices of physicians, nurse practitioners, and other healthcare providers using 2 validated questionnaires. Lastly, we carried out interviews with healthcare professionals and managers for identifying facilitators and barriers for the implementation of dementia care models in primary care. For the feedback component, we shared these results during a focus group at each participating site. We had 8 primary care practices participating in Ontario for a total of 63 participants, including family physicians, nurses, and other healthcare professionals, as well as managers and decision makers. The discussions from the focus group were analyzed using content and thematic analysis. Participants identified organizational factors that could explain the results. As facilitators, they indicated that having additional resources in primary care, as well as a strong link with community services, could help with the implementation and sustainability of existing dementia models. However, they considered that there are barriers, such as the fact that primary care providers are busy, there are insufficient human resources, as well as unclear roles between each actor included in the model. Also, they say there is a lack of support from health and community services for persons living with dementia. Having external memory clinic services close to their practice that are well respected by the community was also seen as a barrier for the use of dementia care models in their practice. Participants also identified clinician factors that played a role. Usually, they consider that the models were better implemented when the practitioner had a good positive knowledge, practice, and attitude towards dementia care. Nonetheless, when the practitioner had less confidence in the process of diagnosing and managing dementia, had negative attitude towards dementia care, and perceived the models had a limited value for their practice, dementia care was affected. In addition, they perceive dementia as an emotion and social border, both for them and for the person living with dementia. Participants considered that there are actions that can help maintain these models and improve the care provided for persons living with dementia. They would like to have more financial incentives, similar for those in place for other diseases, better training in dementia care, having the possibility to share and compare their results with other primary care practices, having clear pathways among dementia services, and having tools that could help improve their shared documentation in dementia care. We can see with our results that audit and feedback processes have the potential of improving the local clinical practices with high acceptance from the participants. The needs and solutions identified here are important for the sustainability of dementia care models and for improving dementia care. The information here can be used also for informing future provincial and federal dementia policies. Thank you.